system, you can see there are articulation of the bones. There is not a one bone continuous from below top to bottom. There are several bones in between, and that are articulating to each other, the bones which are adjacent to it. And that articulations, now you can see from here, you can see in the foot there are different bones. Then after the foot you are having the tibia and fibula, and then this is the patella. After the patella, this long bone is the femur, you are knowing, and this is the hip bone, and then the vertebra and the thoracic cage, and then you can see the cervical vertebrae and the skull here, and the appendicular skeleton. You can see this horizontal bar, that is the clavicle, and the black bone is the scapula and the humerus, and these are the two bones of the forearm, radius and ulna, and the skeleton of the hand. So these bones are articulating. So these articulations are known as joints. These articulations are known as joints. And what is the function of joints? One, to hold the bone securely or tightly in position, as well as hold it and provide the movement, the mobility. Okay, this is the purpose of the joint. And then you are knowing that when there is mobility, that is at the cost of stability. So obviously you have to compromise one thing to achieve the other thing, or other thing to achieve the another thing. And some part where stability is required, where the mobility is zero. Like in the cranial cavity, now there are several bones. Now if you see, you can see here, you can see there is a line. We can see that. You can see this is the line. This is another bone, and you can see this is another parietal bone, and there is another line that is driving it. These are the two bones, but they are not mobile. Not mobile. Here, this mobility is going to damage the underlying structure. So here, the stability is the required. So these joints, these articulations are immobile. And in the hand, in the elbow, and in the hand, you are now here, the mobility is required. So here, this mobility is obviously at the cost of some of the stability. Okay. So there are basically modifications or structures are there to make it mobile as well as stable as far as it can be. Okay, and then these are basically the function and the sum of the terms related to the kinesiology. Basically, kinesiology is nothing but the study of the surfaces. Now, whenever the joint is, you see, this is the humerus, and this for flat bone is the scapula. You can see. Now, you can see here is the concavity. Glenoid, this cavity is known as the glenoid cavity, and now you can see this is the head of the humerus, which is spherical. You can see spherical. And now this is going to articulate like this. Okay, this convexity is going to fit into the concavity. So the part of the bone is having two parts. One is the articular surface, and another is the non-articulating part. Articulating part means is the part of the bone which is actually in contact with the other bone, or coming in contact with the other bone to form the joint, or during the different part of the movement at that joint. And that part of the bone which is taking part into the formation of joint is known as articular part, and the rest is known as non-articular part. You can see the texture of the articular and non-articular. Now you can see the texture of the head, smooth, and now after that you can see the other part, the rough, and you can see the color which is the shaft is a non-articulating, not articulating. Again, the lower end is articulating. Now you can see the surfaces. Basically, you can see the smoothness of the surface. These are the articular parts. So bone is having two parts. One is the non-articular, as far as the joint is concerned. Articular and non-articular part. Articular part are particularly the taking part in the formation of the joint, and the non-articular part is not taking part into the joint. Okay. So now when we are going to talk about the joint, or we are talking about the joint, basically we are concerned here particularly with the articular part of the joint or the bone. Articular part of the bone. Now, articular part of the bone either can be, you can see here, you can see that this part is convex or concave. क्या तुम्हें लग रहा है बच्चों? Anyone answer? क्या देख के लग रहा है? convex. So this either it will be convex or you can see here, इसमें देखो इसका correspondingly इसको रिसीव करने के लिए कैसा होना चाहिए, कॉन्केव होना चाहिए, ठीक है, डिप्रेशन है. So either it is convex or concave. Basically the convex surfaces of the bone are known as the male surface and the female surfaces are the concave surface, basically the receiving. The concave surface is known as the female surface and the convex surfaces are known as the male surface. So head of the humerus is the male surface and here the glenoid cavity will be the female surface for this cavity. Okay, and then you are having basically the simple joint and the compound joint. We are knowing that articulation of bones is joint. The minimum articulation will be between two bones and that joint is known as the simple joint. And when there is more than two bones are articulated, then that joint is known as compound joint. Okay, that is known as the compound. Now, the hip joint. This is the head of the femur, and this is the sternum, the concave yellow part, the concavity. This is the female part, and this is the male part. And so here the two bones are only articulated. This is known as the simple joint. And then there are three joints, now three bones, or more than two bones. Now you can, this is the knee. Knee, you are having the upper bone is the lower end of the femur. And then there are lower bone that is the tibia. Now you can see that here is the tibia, and then after that there is another bone that is the kneecap, that is known as the patella. So three bones are involved here. Apart from classification as the synovial joint, that the condyloid variety, then that according to simple and compound joint, this is the compound variety of joint, the knee joint, because here more than two bones are articulating, and the bones are the lower end of the femur and the upper end of the tibia and basically the patella of the kneecap. Then basically another thing that is here is, now you can see, first we have the degree of movement. Whenever we are talking about the joint, then we are talking about the degree of freedom or degree of movement. What is degree of freedom? Is basically the number of axes along which the movement can take place. Number of axes along which the movement can take place is known as the degree of freedom. Number of axes. Now you can see the elbow joint here. In which place? First tell me which place the joint is taking place. किस प्लेन में जॉइंट हो रही है?
सैजिटल
प्लेन. एक्सिस इसके परपेंडिकुलर होगा बेटा, ठीक है ना? तो देयर इज वन एक्सिस. वन एक्सिस होगा, दैट इज द मोनो एक्सिस. When it is biaxial, now you can see at the ratio. This is flexion. This is in the sagittal plane, and now you can this is in the coronal plane. Two axes are involved. So here 2 degrees of freedom. Okay. Now at the shoulder joint, more than 2 degrees means more than 2 axes. Usually the 3 axis, or when more than 2 axes involved, that is known as the basically multi-axial joint. So uniaxial joint, one only movement in along the one axis, and then biaxial joint where movement is along the 2 axis, and the multi-axial where the joint movement is along the 3 axis. Now you have seen that example. The wrist joint is biaxial, and the elbow joint is the uniaxial, and the shoulder joint the multi-axial. So this is the degree of freedom. Means the number of axes along which the movement is going to take place. Okay, that is known as the degree of freedom. And then another term, when we are talking about the joint, we are talking of. Now the two articulating bone either will be this bone, either will be the full. Here is the articulating surface of the. Now you can see articulating surface of this scapula, and the articulating surface of humerus. Okay, both are articulating. Then there will be two position. One is that the whole articulating surface of the humerus and the whole articulating surface of the scapula are being utilized. Suppose that 80% of it, 80% of it, or 100% of it, and the surface area of this and the surface area of this. Either they are utilized, completely articulating surface are utilized or not utilized. Depending on that, the joint will be called either as closed pack or loose pack position. Now you can see here, basically the maximally loose pack or the closed pack. Here you can see better. Now see the area of contact between these two articulating surfaces. Now this is the lower end of the femur and this is the upper end of the tibia. And here also. Now you can see the area here is maximally utilized and here is the least area or less area utilized during this articulation. So this joint is called as closed pack and this is known as the loose pack position. Now what is the advantages of the closed pack condition? There is maximum contact area, minimum mobility and maximum stability. And there will be opposite of that. You can see the minimum contact, you can say the maximum mobility, or you can see the minimum stability. Okay, so this is the closed versus loose packed position of the joint. Okay, any confusion till now? कोई बच्चा रिस्पॉन्स करो. ठीक, चलो. ओके, नेक्स्ट. नाउ
वैल्गस रोटेशन क्या होता है?
क्या बेटा?
वैल्गस रोटेशन.
अच्छा बेटा, जब हम आते हैं मूवमेंट में तो हम बात करते हैं वाल्गस रोटेशन क्या होता है. ठीक है. वाल्गस में टर्म क्या लगा हुआ बच्चा? जी लगा हुआ. एक होता है वाल्गस और एक होता है वेरस. ठीक है ना. तो जी माने गो. तो जब जैसे मान लो कि ये नी ज्वाइंट हम लोग चलते हैं, खड़ा होकर तो नहीं दिखा सकता, लेकिन यहाँ देखोगे ये जैसे ये दोनों नी ज्वाइंट जब आपस में क्लोज हो रहे हैं तो इसको हम वेरस कहते हैं. अगर अवे जा रहे हैं तो इसको हम वाल्गस गो. अब इसी तरह से जैसे नॉक नी कहते हैं, तो नी ज्वाइंट कुछ लोग चलते हैं तो नी उनके सटे हुए चलते आपस में, तो दिस पोजिशन इज वेरस. यानी कि नी ज्वाइंट ऐसे आ गए, दो ज्वाइंट नी है ऐसे चल, नी ज्वाइंट क्लोज आ गए, इसको हम वेरस कंडीशन कहते हैं. और जब ये वैल्गस अपोजिट हो जाते हैं इसको हम वाल्गस कहते हैं. ठीक है बच्चे? गॉट इट?
Yes sir, yes sir.
ठीक. Okay. So now basically there are different classifications of the joint, but broadly that classifications which usually used or asked is a structural classification. Now you are knowing the functionally we can say joint, whether it is mobile joint or immobile joint or a joint in between, slightly mobile, like the joint of the skull, cranial cavity, cranium, immobile, mobile, shoulder joint, mobile, and there are some joint of the vertebrae that are slightly movable. Similarly, they are called as synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis, you are knowing that it is the immobile joint. Diarthrosis is a freely movable joint, and amphiarthrosis is the slightly movable. Nothing to basically just you have to know the meaning of this term. You might be knowing it. It is just reinforcing some of the facts you might not be aware, but yes, it is just the reinforcement of the previous existing knowledge. Now another, you might also be aware of this, that the structural classification, basically the structural classification is based on the structure between the two bones, articulating bones. Which is structure in between? Suppose this is two articulating bones. If the bones, whether it is a fibrous tissue, connection is due to the fibrous tissue, that is known as the fibrous joint. When there is this connection is cartilage, then this is known as the cartilaginous joint. When there is a joint cavity, that is known as or synovial membrane, that is known as the synovial joint. Now, basically cartilages, you might be aware, this was the term of the previous class, bones and the cartilages. At least you might be knowing there are three types of the cartilages. One is the fibrocartilage, elastic cartilage, and hyaline cartilage. There are three cartilages. Okay. Now, so depending on the structure between the two bones, articulating bone, this structural classification is dividing the whole joint into three categories, that is the fibrous joint, cartilaginous joint, and synovial joint. In the fibrous joint, it is the fibrous tissue. In cartilaginous joint, it is the cartilage, whether it is the fibrocartilage or the hyaline cartilage. And then on the synovial, another is the presence of the cavity or the synovial fluid, synovial membrane. There are other structures also. Simply you can say here the cavity, and then the mobility is also the criteria. Then that joint is known as synovial joint. Synovial means synovial fluid and synovial membrane. These are the two terms which are specific for the synovial joints. So these are the three. There are the three types of the joint, and then we are going to take these joints one by one. Now, the fibrous joint, as I have told you that, or you are knowing by the name itself, that here the bones, the two joining bones are basically united by the fibrous tissue. And then this fibrous basically joint is classified under the three heading of basically the three types. That is the sutures, syndesmosis, gomphosis. Somewhere gomphosis is written as another part, but basically gomphosis is one type of syndesmosis. Sutures, here there are fibrous tissue. The two bones are connected by fibrous tissue. Now, just see the structure here. The sutures. Now, basically see the sutures in the skull. You can see here. Now, this is the skull. You can see this here, fine line. These are the sutures. They are the joint. This is the frontal bone, and then the two parietal bone. You can see there is basically this suture is in midline. That is why this suture is also known as the sagittal suture along the sagittal plane. Okay. And then sagittal suture, there are the parietal bone. Now, zigzag. Basically, serrated margins are fitting into each other. So, depending on the margins or the shape, the different fibers, basically the sutural joints are of different types. One is the serrate suture. Serrated means there are serrations and the serrations are going to fit to each other, giving the serrated appearance. So that here you can see that this is a serrated suture. Okay. Now denticulate. You can see the B. You can see the slide, the B structure. Here basically like teeth shape. They are fitting into each other. There is a gap, corresponding gap, and then they are fitting into each other. Basically somewhere basically pavement is also सड़कें बनी है कुछ आजकल सीमेंट ईंटें आती हैं जिनमें एक दूसरे को हुक लगे होते हैं फिट कर देते हैं उसमें ठीक है तो they are nothing but the basically the denticulate type of arrangement. And then the squamous means flat. Squamous epithelium, flat. The term squamous means flat. So here when the surfaces are flat, articulating surface suture membrane, then that is known as basically the squamous type of the suture. And the plain, simple, plain suture. And now syndialysis is one type of sutural basically joint. Here the basically one ridge of one bone is fitting into groove. Suppose that this is the groove, and then one ridge is fitting into it. Typical case is the vomer. Now you can see here the rostrum of a sphenoid bone, red, and this vomer. This vomer is having the groove, and the rostrum of a sphenoid is fitting into this groove, and that type of sutural joint is known as syndialysis. Okay. So we have talked one type of fibrous joint, that is the suture, and different type of the sutural joints are there depending on the basically surface of the articulating bones. If they are serrated, red suture, dentate, denticulate, teeth-like structure, fitting sockets, then denticulate suture, squamous flat, squamous suture and the plain suture and syndhylasis, where there is a groove and ridge of one bone is fitting into that groove, and that is known as the basically syndhylasis variety of suture joint, which is one of the fibrous variety of the joint. Any confusion till now?
सर स्क्वैमस और प्लेन में क्या डिफरेंस है?
क्या बेटा?
स्क्वैमस और प्लेन में क्या डिफरेंस है?
स्क्वामस में जब ये होता है प्लेन, मतलब कि प्लेन इज जस्ट हैविंग ए मतलब स्क्वामस इज हैविंग सम एरिया ग्रेटर देन द प्लेन सुचर. बेसिकली बोथ आर द फ्लैट. द डिफरेंस इज जस्ट बेसिकली द एरिया. ठीक है. लाइक स्क्वामस epithelium is having the largest area because the whole it has to cover the surface. सपोज करो हमें घर में फ्लोर को कवर करना होता है तो हम टाइल्स लगाएंगे. ऐसे टाइल्स लगाते हैं जिसके सरफेस एरिया ज्यादा है. कॉलमनर टाइल नहीं लगाएंगे जिसका लंबाई ज्यादा है, ऊंचाई ज्यादा है, कॉलम ज्यादा. वैसे टाइल्स हमारे लिए काम नहीं करेंगे, वो वेस्ट होगा हमारा मटेरियल. लेकिन हमें सरफेस कवर करना है तो हम फ्लैट टाइल्स लगाते हैं. ठीक है. इसी तरह से फ्लैट एपिथेलियम लगी हुई है हमारे बॉडी पे, सरफेस एरिया ज्यादा है तो इस वजह से उसको कवर करने के लिए जहाँ जरूरत है वहां पे हमको फ्लैट स्क्वामस एपिथेलियम लगी हुई. ठीक है. Similarly here it is having larger area as compared to the plain suture. Both are the flat. Okay.
Yes, sir.
Then the next, as the syndhylasis, I have told you, an articulation in which bones are joined by fitting the ridge of one bone into the groove of another. Example is vomer. Vomer fit कर रहा होता है. ठीक है. Rostrum of the sphenoid को रिसीव कर रहा होता है वोमर. नाउ अनदर joint, another type of fibrous joint is syndesmosis. Syndesmosis variety. Just we have the now sutures. After the sutures, syndesmosis. Now we are talking about the syndesmosis, where the two bones are joined by ligament. In suture, they are the fibrous tissue. They can't be called as ligament. They are just fibrous tissue. Here they are defined ligaments, and they are not as close as the sutures. Okay. Now you can see this is the tibia and this is the fibula. In between you can see these are the interosseous membrane. This is ligament which is connecting. There you can see lower down also that there are 1, 2, 3 accessory band, primary band. You can see distal accessory band ligament, anterior tibiofibular ligament. There are the ligaments. So these ligaments are connecting basically these two bones, and this bone is known as, but basically this type of joint is known as the syndesmosis. So the upper tibiofibular joint, this is the lower tibiofibular joint. This lower tibiofibular joint is also a type of syndesmosis. The upper tibiofibular joint is also a type of syndesmosis, and in between interosseous membrane is also the ligament, that is also the syndesmosis. Similarly, in the case of the radius and ulna, here in case of the fora, the two bones are joined together by ligament, interosseous membrane and the sum of the ligament, and then that joint is known as the syndesmosis. Okay, so basically by a structural classification, we are having three types of the joint. One is the fibrous joint, another is the cartilaginous joint, another is the synovial joint. In fibrous joint, we are having three types of the joint, that is the sutures. We are having different type of the sutures depending on the surfaces, or basically depending on the shape of the articulating area of the different bones in the sutures. And then we are having syndesmosis. Here the syndesmosis, the two bones are joined by ligaments. The typical example are the tibiofibular ligaments, superior and inferior, basically joint, superior and inferior tibiofibular joint, in between the interosseous membrane, and then the radio-ulnar joint, in between by the ligament, and then another variety of the fibrous joint, the gum fossis. Basically, you can say here, it is also called a dentoalveolar syndesmosis. It is also a syndesmosis. Somewhere it is written as a different type of the fibrous joint, but another name is dentoalveolar because the teeth are fitting into the alveolar sockets. Okay, and here what happens? Basically, here binds the teeth, binds the teeth to the bony sockets. तो यहाँ देखो, you can see here sockets are, ये पूरा sockets बना हुआ है, जिसके अंदर ये इसके अंदर फिट किया हुआ है, ठीक है ना। तो इसको अब यहाँ पर हम तुम्हारे ध्यान में क्वेश्चन होगा, why it is not called as syndhylasis? Here there are ligaments, पढ़ोगे है ना, ligaments है, तो इसीलिए इनको syndesmosis भी कहा, ठीक है, ओके। And this basically tooth, the teeth and basically their joints with the alveolar process or the maxilla, that is the example of the gum process. Now the next, before going to the next, any query till now? 30 seconds break. If you are having any question till now, गॉम्फोसिस में बच्चे, ये जो हमारा टीथ है ये सॉकेट में फिट है, ऊपर मैक्सिला ये बोन है, नीचे ये मैंडिबल है, ये एल्वियोलर है, एल्वियोलर प्रोसेस ऑफ मैक्सिला है। यहाँ पर एक सेक्शन है, इसमें देखो ये पूरा उसको फिट करता है। यहाँ इसके लिगामेंट लगे हुए हैं, जैसे कि सिंडेस्मोसिस में लिगामेंट क्लोज करते हैं, उस तरह से यहाँ भी लिगामेंट होता है। इसको हम सिंडाइलेसिस नहीं कहते, ठीक है। और ये गम टीथ ही इसका एग्जाम्पल दिया, ठीक है, okay. Next, the cartilaginous joints. Now, if cartilage is present between the two articulating bones, that or attachment is due to the cartilage, then that joint is known as the cartilaginous joint. And here, basically, there are two cartilages. If there is presence of the fibrocartilage, that joint is known as the secondary cartilaginous joint or symphysis. And when there is hyaline cartilage, then it is known as the primary cartilaginous joint. If there is hyaline cartilage, the joint will be called as primary cartilaginous joint or synchondrosis. When there is fibrous cartilage, fibrocartilage, then the joint is known as the secondary cartilaginous joint or symphysis. So cartilaginous joints are two types of joint, that is primary cartilaginous joint and primary cartilaginous joint and the secondary cartilaginous joint. In primary cartilaginous joint, the connecting joint is the hyaline cartilage, and another name of the primary cartilaginous joint is synchondrosis, and another name of the secondary cartilaginous joint is symphysis. Here the two bones are joined by the fibrocartilage. Okay, now see here the example. Now here the ribs, thoracic case में जो हमारे ribs हैं, basically they are having the cartilage यहाँ blue से दिखा हुआ है, और ये जो bony part है वो तुम्हें दिख रहा है यहाँ से. This is on the costochondral joint. Costochondral joint is example of primary cartilaginous joint, and at the primary cartilaginous joint there is no movement at all. There is no movement at all. And then there is, this joint is also present between the diaphysis and the epiphysis or epiphysis. Now this was the part of the bones that we have left. The sharp, just the long bone, there is the shaft is known as the diaphysis. The growing end, the two end, the other end are known as epiphysis, and then the epiphyseal end of diaphysis. Diaphysis है, इसका epiphyseal end जो epiphysis से लगा हुआ है, that is known as the metaphysis. Okay, so here you can see here another thing that the epiphyseal plate is hyaline cartilage. So between the epiphysis and the diaphysis, this bone, this joint is basically the primary cartilaginous joint, and now there is no movement at all. So primary cartilaginous joint, also known as the synchondrosis, is where the hyaline cartilage is present. Example is costochondral joint, that is the primary cartilaginous joint or the synchondrosis. Now another example is basically the joint between the diaphysis and the epiphysis of the epiphysis of the long bones, and that joint is known as the basically the primary cartilaginous joint or the synchondrosis. Now the secondary cartilaginous joint are usually in midline. Now this symphysial joint, name itself is a symphysial joint. Basically it's pubic symphysis. Okay, so this is basically this joint is the fibrocartilaginous joint, and now this joint here between the vertebrae. Now you can see vertebral disc is there, and they are the example of secondary cartilaginous joint or the symphysial joint. Here there is presence of the fibrocartilage. Okay, so this is about the cartilaginous joint. Then another joint you are well versed with or aware with, where the maximum mobility is there, is the synovial joint. In case of secondary cartilaginous joints, some movement are allowed, some movement are going to occur. But primary cartilaginous joint, there is no movement at all. Synovial joint, as the name indicates, synovial joint means there is synovial membrane. Then there is a cavity, basically the classification based on the cavity. Here the synovial membrane secretes the synovial fluid. So any synovial basically joint, there are some characteristics. Usually if you are knowing the characteristic, at least if you are not knowing the joint, you can write about the joint. Basically, if some of you are being asked when you will be taught about the regions, then you will be taught separately the joints, the shoulder joints, elbow joint, the joints of the wrist, or joints of the hand. Then you are being asked to write short notes on the elbow joint or short notes on the shoulder joint. So if you are not aware of, at least you are not knowing the general features of the synovial joint, what are the general features that have to be present in synovial joint. So these are the features that will usually are going to be present in the synovial joint, typical synovial joint. So then what that features are? Every synovial joint is going to have the cavity, joint cavity, and the articulating surfaces of the bone, the articulating surface ahead of the femur, this is lined by hyaline cartilage. Not joined, two surfaces are not joined by hyaline cartilage. Here the two are lined by hyaline cartilage. Don't confuse with the presence of the hyaline cartilage here as compared to the primary cartilaginous joint. There the joining factor is hyaline cartilage. Here the articulating surface of the two bones are lined by hyaline cartilage. And then there is joint capsule. The two bones are joined by a capsule. दोनों यहाँ पे मिल गए, तो इसको कवर करने के लिए एक कैप्सूल होता है. एक तुम्हें मैं डायग्राम में देखा हूँ. Now you see, this is joint capsule. See, this is a joint capsule. यहाँ से देखो ये पूरे कैप्सूल को ज्वाइन कर रहा है, ठीक है. यहाँ भी ये देखो ये पूरा जो ये लाइनिंग है, दिस इज कैप्सूल, ठीक है. ये नीचे ये पूरा जो आ रहा है, ठीक है ना, यहाँ से नीचे से फाइबरस कैप्सूल पूरा यहाँ से लाइन कर रहा होता है, ठीक है. ये कैप्सूल कहलाता है, ठीक है. तो पहले हम इसको देख लेते क्या क्या ज्वाइंट कैप्सूल विल बी देयर, एंड देन द कैप्सूल, सपोज दैट दिस इज द कैप्सूल. इस कैप्सूल के अंदर है बोन कवर है, and this capsule is lined, inner lining capsule की होती है, that is lined by the synovial membrane, and that synovial membrane is synovial fluid, and then the bones here are connected by the ligaments, and there is movement at the joint. Now you can see this structure in this diagram, that you can see the articulating bone, you can see the articulating cartilage. This articulating surface is lined by hyaline cartilage. Okay, this articulating surface is lined by hyaline cartilage. This is joint cavity. Joint cavity. This is the capsule. You can see the two color of the capsule. One is the outer color. You can see some inner dark. This inner lining is the synovial membrane, and that inner lining synovial membrane is secreting the fluid into the joint cavity. Okay, and now you can have the ligaments, the person ligaments that are connecting it. Okay, so these are the parts of the synovial joint. Here you can see this is the shoulder joint. Taking basically you can say SLH or coronal section you can say, to show you the different parts of the joint. This is the head of the humerus, the scapula. This is the cavity. Now the articulating hyaline cartilage. This is the joint cavity containing the synovial fluid, and these are the ligaments. These are the ligaments, you can say the ligaments here, ligaments. Okay, and then bursa. We call bursa lubricating device. Here that there is movement, then there is a presence of bursa fluid sac-like structure, lubricating device which is present there. That is called as the bursa. Okay, now these are the general features of the synovial joint, and then after that, depending on the shapes of the articulating surfaces, these synovial joints have been classified into different varieties. You might be aware of. Just have a look on the slide. 30 seconds. Then I am going to talk about it. Yes.
Explain bursa.
Be bit louder.
Explain bursa once more.
Bursa basically, bursa is a closed sac-like cavity. कोई एक थैला ले लो, ठीक है, ऐसे रबर बैग ले लो जिसमें पानी भरा हुआ हो, ठीक है ना, रबर बैग पानी भरा हुआ हो उसको, तो ये अब उसके ऊपर नीचे कोई चीज रख दो तो उसको स्लिप करना आसान होगा। जैसे मान लो वुडन ब्लॉक हम ले, वुडन ब्लॉक, दो ब्लॉक, एक ब्लॉक के ऊपर दूसरा ब्लॉक रख दे तो इसको पुश करेंगे तो बहुत ज्यादा फ्रिक्शन होगा, इट विल टेक मोर फोर्स इज रिक्वायर्ड टू मूव इट। और अगर इस बीच में इसे वाटर फील्ड बैग को रख दो तो इस ब्लॉक को मूव करना आसान होगा, एंड द फ्रिक्शन बिटवीन द टू ब्लॉक्स विल बी अवॉइड। तो बेटा यहाँ पर देखो ये सारे बोन्स है, बोन्स के ऊपर ये मसल, बोन कैल्शियम हाइड्रोक्सी एपेटाइट पत्थर जो होता है, और उसके ऊपर लिगामेंट सॉफ्ट पार्ट घिस रहा है मसल, ये तो टियर हो जाएगा, कभी भी टियर हो जाएगा। तो जस्ट अवॉइड इट, देयर इज द प्रेजेंस ऑफ लुब्रिकेटिंग डिवाइस दैट इज सैक लाइक स्ट्रक्चर, फ्लूइड फील्ड, ठीक है, ये होता है। यहाँ देखो, यहाँ पर ये देखो, ये बर्सा जो है, यू कैन सी दिस इज द बर्सा, बीच में येलो कलर फ्लूइड दिख रहा है, ये चूंकि सक्शन लिया गया है इसलिए ऊपर ये मसल का टेंडन है, ये नीचे। अब ये ह्यूमरस मूव भी करेगा, अब यहाँ पर जब इसका इन्फ्लेमेशन हो जाता है हम उठा नहीं पाते, वर्साइटिस कहते हैं, ठीक है, डिपेंडिंग ऑन दैट की बाकी क्या फ्रोजन शोल्डर भी हो सकता है, डिपेंडिंग ऑन which type of infection is there, what is the severity of the infection. Okay, now coming to the different varieties, you are knowing it. Just plain joint, plain synovial joint. Now अब रिकॉल करो, बाकी तब इतना बोन्स का क्लास तो पूरा एक क्लास तक नहीं ज्वाइन किया है। कार्पल बोन्स, हियर देयर आर 8 कार्पल बोन्स। कार्पल बोन्स यहाँ देखो इसमें दिखाया है, ये कार्पल बोन्स, इनके बीच में जो ज्वाइंट है वो प्लेन साइनोवियल ज्वाइंट, मूवमेंट पे प्लेन, बिल्कुल प्लेन साइनोवियल ज्वाइंट, मींस कि द सर्फेसेस व्हिच आर आर्टिकुलेटिंग आर हैविंग बेसिकली प्लेन सर्फेसेस, कोई कॉन्केविटी या कॉन्वेक्सिटी या रेसिप्रोकल कॉन्केवो कन्वेक्स इस तरह का स्ट्रक्चर नहीं होता है, इस तरह का। जी हेलो, क्लास चल रही है, ठीक है। Yes, now basically this is a plain synovial joint. Then after that we are having, this is basically the example is carpal, the joints of the carpals, 8 carpals of the beach. Then we are having the hinge variety, you are well versed with the hinge variety, okay, and basically the elbow joint, and then see, you can see the pivot joint. Now you can see here, pivot joint, see, basically this is the ulna and this is the head of the radius, pivot joint is ठीक है, okay, radius ulna. Now when this is the elbow joint, and now this pronation and supination, ये elbow joint का flexion extension हो रहा है, And pronation and supination. Pronation and supination is taking place at the radio-ulnar joint, which itself is the pivot variety of the joint. Now the D. ठीक है, this is the condyloid joint. क्या है? Now you can see here. Concavo-convex. One surface is convex and another surface is concave. Male and female surfaces. Okay. This is between, you can see, the phalanges. Metacarpophalangeal joint. Metacarpophalangeal joint. Okay. Then we are having the saddle joint. घोड़े का सैडल देखा है, उस पर रखा जाता है, घोड़े के ऊपर रखते हैं, तो अंदर से कॉनकेव होता है, ऊपर से कन्वेक्स होता है. ठीक है, कॉनकेव कन्वेक्स. अब यहाँ पे देखो, यहाँ दिखाया हुआ साइड टू साइड कॉनकेव, और इसमें देखो ये कॉनकेविटी है और ये कन्वेक्सिटी है. यहाँ बीच में कॉनकेविटी हो और साइड टू साइड कन्वेक्स हो, कॉनकेव कन्वेक्स बोथ सरफेस. ठीक है. एंड एग्जाम्पल सैडल जॉइंट का. ठीक है, ये फर्स्ट metacarpophalangeal joint. First metacarpophalangeal joint is example of it. And then we are having basically the E ball and socket variety. You are knowing it. Example is the humerus, the shoulder joint. Okay. And then another joint which is the ellipsoid joint. Here basically the ovoid convex surface is fitting into the elliptical concave surface. The surface जो रिसीव कर रहा होता है वो elliptical होता है, और जो ये ovoid convex surface होता है इनसे बन रहा होता है carpal bones का proximity से. And now you can see there is a concavity there, but this concavity is here elliptical in shape. तो इसको ellipsoid joint कहता है, wrist joint. Basically wrist joint is example of it. Okay, these are the different types of the cervical joint. And now just basically quickly, what are the clinical load, what are the problems, some of the problems that we are going to deal with the knowledge of joint. Now one is, as you have seen that in synovial, in fibers, basically secondary cartilaginous joint. Secondary cartilaginous joint here, the fibrocartilaginous disc is present between the two vertebrae. When there is pressure, sometimes there is bulge or sometimes there is rupture. When there is a rupture or bulge, it is going to compress the corresponding spinal nerve or the spinal cord here. Now you can see. Either if there is bulge, then depending on this bulging disc is going to compress the cord behind, or basically part of the cord, or the nerve, the spinal nerve, which is going to come out. And this is one of the common cause of the back pain. Okay, and now this pain is radiating along the nerves which are coming out of that root, formed by that root. Now usually it is the sciatic nerve, so the pain is radiating toward the whole foot, and then there is a back pain in the back radiating to the basically distribution of that nerve. Okay, so this will be either due to bulging of the or due to herniation of the disc. Disc ऐसा था, एक तरफ निकल गया, ऐसा पाउच की तरफ निकल गया, herniate कर गया. ठीक है. Then shoulder dislocation, you might be aware of, might be heard of. Now you can see there is anterior dislocation, posterior dislocation, and there are factors, and you can know which dislocation is common. Okay. Now when there is infection, one of the infection of the osteoarthritis of the knee joint. Now you can see here the normal joint. Now you can see the articulating cartilage here. The articulating cartilage is the hyaline cartilage. Now you can see the changes in it, and then you can see the corresponding change in the tibia, spurring of the tibia bone. There are spikes are coming out, and then when the two surfaces are coming into contact, these spikes are going to hit this injured area, and then there is corresponding huge pain. It is so huge pain, or so the basically patient is not able to stand, if you can see, or can walk in old age, or some patients who are having this. When it is infectious, it can be treated, but some of the cases are degenerative osteoarthritis, where there is degeneration related to the age. Then there is only way is to replace the knee, that is TTR, total knee replacement. Now TTR is performed, knee replacement total of depending on what is required and which is suitable for the corresponding patient. Okay. Then another condition you can see the meniscal tear, basically meniscal tear or injury when during a sports injury or sometimes in slip भी हो सकता है, ठीक है. So menisci are the ligaments in the knee joint and that are basically torn. Then there is a corresponding damage and the corresponding problem of the patient. Now you can see the tear will be either longitudinal, यहाँ देखो रिपेयर किया इसको, ठीक है, depending on. तो यहाँ either there is longitudinal meniscal tear or there is tear of the anterior or posterior cruciate ligament. These are the ligaments basically because they are along the cruciform, basically of the shape, resembling the shape. They are these ligaments are not the cruciate. So there might be tear of the tear or basically the ligament can rupture, and depending on that there will be the sign and symptoms for the disease. Okay, so sports injury, and then there is Charcot's joint or the neuropathic joint. Now you can see here all the bones, there is bones formation about the end of the obviously lower end of the tibia. That and this is that when there is denervation of the nerves. Nerves are cut, basically cut नहीं किया हमने, इफेक्ट वही हुआ, डिनर्वेट हो, यानी कि नर्व ही उसकी सप्लाई बंद हो, denervation, and then there is basically sensations are lost, and that is the this condition result in कहाँ किन this is found in diabetes. शुगर के मरीज को देखना अक्सर पैर में जो घाव होता है भरता नहीं है, या क्योंकि नर्व सेंसेशन लॉस हो जाता है, उसे पता ही नहीं चलता, दर्द ही का पता नहीं चलता, तो फिर उसको प्रोटेक्शन कहाँ से करेगा, ठीक है. देन अल्कोहलिज्म ऑल्सो, syphilis, leprosy, meningitis, spinal cord injury, syngomyelia, dialysis, they are the different conditions in which we are going to have neuropathic pain or neuropathic joint. Okay, and then coming to the questions. ठीक है बच्चों, इसका आंसर कौन सा आंसर होगा? Yes, it's in chondrosis. Okay, now the next question. Yes. Okay. Okay. Till now, any query by your side? What I have told you, any problem? Okay. Be on happier side that you understood all things. Yes, this was the last class of the general anatomy. Okay. Then we will meet. I hope that we are going to meet you face to face sooner. Inshallah. Okay. Thank you. Now, this class is over. You can leave.